So yes, that's interesting to gauge also how you're progressing from the reaction of others in a way. And the reaction of others was generally not too negative on most occasions.
Not at all. In fact, the time I found the most bizarre, when I was still in hospital, you were being wheeled from pillar to post all around the hospital. The visitors and the other patients generally didn't particularly look at you very much. You know, most of us have been brought up, don't stare at people. And the people that tend to stare at you the most were actually the nursing staff. And whether that, you know, most of them had the biggest shock on their faces, going blimey, whether they're wondering medically what on earth that poor bugger had done, I don't really know. But I found they were the ones that sort of stared the most, and that again, that amused me. Out of all the people in the world, you'd have thought they'd have been used to seeing some pretty ghastly sights. You know, initially you've got staples all round your neck, looking like Metal Mickey with a zip round your neck. You know, and they stared the most, but the public were generally very kind, you know, and very empathetic.
Did you ever have a problem going out? I know you did face those kind of fears and the unknown by going out, but was a bit of you nervous about going out initially? Because you know, like you say, things were very difficult at that early stage.
I was more concerned about physically managing going out, because even though I was they tried to set me a challenge before my surgery to try and, I was young, they wanted to get me out as quick as possible, they wanted me to recover as quick as possible, they're very keen to try and get you to get back on track with your life, because you're young and you have a life, and you've got the rest of your life to, you know, you've got to deal with. And they set the challenge saying, you know, the person we've had out the quickest was 2 weeks and 2 days or something like that, and want to see if you can beat it, you know. Well, I'm not the sort of person, I'm not competitive, I'm not in any way, shape or form, but they happened to get me out 1 day short of 2 weeks, which was great. Good. However, for me to be able to do that, I had to have constant care at home, which is where my mother quit her job and came and lived with me for 5 weeks. And during that 5 weeks, the physical effort to actually get out of the house, get around the house, is astronomical. The first time you climb a set of stairs, you know, you find it hilarious. Well, I found it hilarious when the physiotherapist came round saying, right, we're going to climb a couple of stairs today, and you think, I'd do that 2 at a time, even at my age, you know, and you think, yeah, okay, by which time you're having a good shuffle around the ward, and you're thinking, stairs are nothing, you know, what on earth you want to take me upstairs for? You know, so you'd shuffled out to the landing, and there's your stairs, and you wouldn't believe, it's almost like you've either hit a brick wall or someone's trying to push you back down the stairs to climb those first couple of steps. And I couldn't do it for laughing, because I couldn't believe how you physically feel and how you couldn't lift your legs, because there was lead weights at the bottom of each one to climb those stairs. So that takes a long time for your body to be able to do that. So even when I went home, and I didn't have a downstairs toilet, so to go to the toilet I would have to go up the stairs, and the physical effort involved to just get up and get your 40-sip drink to inject, because I had a tube for feeding for many months, because I was nil by mouth for a good 4 or 5 months.
That's an issue.
So, you know, to do that, if my mother wasn't there making me do that and fetching that for me and literally putting it on a tray in front of me, and on some days I didn't have the strength to lift my arm to even pull the syringe back to inject myself, so my mother would have to do that, and that's quite normal. Even at my age, I can't imagine being 60, 70 years of age and having to do that when you've got age against you as well, and perhaps not quite so physically fit. And I just can't imagine what that must be like. But, you know, I'm now understand, and I now realise that you can't beat yourself up about these things. You have to go through this, and you have to accept. Accepting is such a relief, really, once you learn to accept that you are physically capable of doing what you can do right now. You physically look like what you look like right now, and it's going to take you at least X period of time, a year, 2 years, to begin to feel back to the old person that you once were. And once you've accepted that, you're going to find life so much easier and so much better. And 99%, I'm sure, 99% of anyone's difficulties, no matter what they are, if you accept the way things are right now, the future will come much quicker.
But there's another side to that. Although accepting it is important, pushing yourself forward and doing a little bit of something, like you were saying, the effort maybe to go to the loo when it was upstairs could actually pay off, because you're doing a little bit more than the average person, if you like.
Yeah, you still have to also accept that you have limitations, and you do have to push yourself, and you do have to make yourself, and 99% of that is in your mind as well, because you go through a huge period of time of woe is me. You go through a huge period of time where you can't be bothered. You don't want to do anything, you don't want to speak, you don't want to be with anybody, but then you want company, and then you do, then you don't, and you go through huge periods of time. You spend day in, day out crying for no apparent reason. And you go through all of these periods, but to get past them, yes, you have to push yourself. You have to have that desire to want to do it. And without that desire to want to do it, it's not going to happen. So yes, you have to push yourself within your limitations.